Extract 1. Questions 1 to 12.
You hear a nurse talking to a patient called Mr. MacDonald. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. MacDonald. I understand you're here to have a lump removed from your back, and the plan is to send you home later today.
Yes, that's right. The lump really needs to come off. It's more than a little annoying, and it can be quite painful too. It's near my waist and gets in the way of the waistband of my trousers. I'm not particularly worried about the surgery. They explained everything to me very clearly when I was at the assessment clinic, but I am concerned about how I'll go later on when I'm recovering. Did they tell you I have Parkinson's disease?
Yes, it's here in your notes from the clinic, but it doesn't say how long you've had it or anything about how it affects you.
Oh, I've had it a few years now. 5, I think. The walking is the worst. It's difficult to start moving, and I'm so slow. All I can do is shuffle to start with, and then my steps get shorter and shorter, and I get faster and faster. Sometimes I even fall over.
Right, I see.
I also sometimes get that freezing thing that happens. You know, where you're stuck in the one spot. Aching something, I think they call it.
Akinesia.
Yes, maybe. You'd know better than me. Anyway, it'll come on me when I least expect it, and always at the worst possible moment. I worked out that if I try and do more than the one thing at once, that almost always brings it on. I also get this terrible shaking in my hands, and it's hard to do some things because my arms are so stiff.
What activities are most difficult for you?
It sounds ridiculous, but it's mainly things like turning over in bed, reaching for a glass of water or a plate of food, getting up out of a chair and then turning around once I'm standing. That can be a challenge. I've learned a few tricks to help though, like having a good firm mattress and a high back chair with arms.
What about activities that need fine movement? How do you manage with those?
Well, tying my shoelaces is a real problem. And buttons. Doing those up is almost impossible. I like that material that sticks to itself. It's very handy. What's it called again? Velcro, that's it. Also, my handwriting is terrible. I've basically given up on it.
It sounds like you might benefit from seeing an occupational therapist.
Yes, maybe. I'll have to speak to my GP about a referral. One of the other main problems I've had during the past 12 months has been the cramps I get at night. They really ruin my sleep.
I understand your medication has been changed recently.
Yes, that's right. I said to the doctor they'd gone on for far too long, so she said I should try some different tablets. I've only been on them for a month or so, but I think they've really reduced.
Extract 2. Questions 13 to 24.
You hear a doctor talking to a patient called Alejandro.
For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning, Mr. Alejandro. Can you tell me about your problem?
Doctor, over the past week, I've been getting an increased shortness of breath. I have also developed some abdominal pain. However, I was continuing my regular activities until the other day when I passed out at home. My wife called paramedics and I was brought to the emergency ward.
Oh, I see. What's your age?
35, doctor.
Your diagnosis report shows bilateral pulmonary infarcts and increasing BUN and creatinine. What medication you are taking?
Heparin.
Do you have any past history of any renal problems?
No, doctor. I was feeling completely normal until recently.
What about your appetite?
It's good.
Any swelling in your feet or ankles?
No, doctor.
Do you have chest pain?
No, doctor.
And your bowel and bladder habits?
Normal.
Any sudden weight loss?
No, doctor.
Your blood pressure level is 130 on 170. There is no organomegaly and no peripheral edema. Your laboratory reports show hemoglobin count 14.8, white count 16.3, sodium level 133, potassium 5.1, chloride 104, and CO2 of 19. BUN test shows 26 and creatinine level is 3.5 and earlier it was 0.9. The CAT scan report of your abdomen shows poor perfusion to your right kidney. I think you have acute renal failure, probably vein thrombosis. Hypercoagulable state is indicated. Deep venous thrombosis with pulmonary embolism. Probably you have developed azotemia due to elevation of blood urea nitrogen, BUN, and serum creatinine levels. Your exposure to intravenous contrast materials may be the primary cause of your condition. I am going to prescribe you rivaroxaban 20 milligrams per day for anticoagulation. Hopefully with this anticoagulation, there will be some relief for your renal vein thrombosis. Or else, if your renal failure becomes progressive, I would advise dialytic intervention. I advise you to undergo a triple renal scintigraphy to investigate the 3 phases of your renal functioning system. In this diagnosis, a small amount of radioactive substance will be injected into your vein that is taken by the kidneys. This diagnosis involves the use of radioactive substance to investigate your kidneys and assess their function.
Thank you, doctor.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Question 25. You hear a nurse talking to a patient whose 6-month-old baby is having childhood immunizations. Now read the question.
Thank you for bringing him today. So, he's having the 6-in-1 vaccination, which will protect him against 6 very serious diseases: whooping cough, tetanus, polio, hepatitis B, diphtheria, and Haemophilus B. Now, before I go any further, I'd like to make it clear that there's no risk whatsoever of your baby contracting any of these diseases from the vaccination, as it doesn't contain any live organisms. You may notice a few side effects, which could make him feel a bit irritable for a few days afterwards. There might be a slight red swelling or small bump at the injection site, and his temperature might be slightly higher than usual. If he develops a fever, keep him cool by giving him cold drinks and removing any heavy clothing. You should contact the doctor immediately if his temperature goes above 39 degrees. This is the first of 3 doses he'll be getting to ensure strong immunity. Each dose increases his immune response, and he'll need all of them.
Okay.
Question 26. You hear a pharmacist talking to a customer about an emergency contraceptive. Now read the question.
You should take this as soon as possible. It might make you feel a little bit queasy, but if you're actually sick within 3 hours of taking it, you should go back to your doctor as you'll need another dose.
Oh, really? How likely is that? It doesn't usually take much to upset my stomach, and I'm about to start a long shift. There's no way my manager will let me off to see a doctor.
Well, if you're really worried, I can give you something over the counter, but you might still feel nauseous, and it'll probably make you a bit drowsy.
Oh, it doesn't matter. I'll just have a coffee and take it easy. I can't risk throwing up, though. I don't want to have to take more time off for another appointment. It's really inconvenient.
Question 27. You hear a practice manager talking to a physiotherapist who's about to carry out a home visit. Now read the question.
Mrs. Rumble hasn't come to any of her appointments so far, and we're not quite sure why. She needs acute therapy after her knee replacement, and we can't have her missing them. Anyway, we've agreed for her to have a few home visits first, and then, hopefully, after a while, she'll feel more positive about coming in. While you're there, maybe you can check her reasons for not wanting to come to the practice. Oh, and give her daughter a quick ring first to make sure they're both expecting you. There have been a lot of misunderstandings with these appointments. She also needs to sign these forms. If you could help her check the information's correct, I've already filled them out for her, but she needs to sign the bottom. When she's done them, can you bring them back here and give them to the receptionist?
Question 28. you hear an occupational therapist talking to a patient who's recently suffered a stroke. Now read the question.
So today we're going to be looking at how to improve your upper arm strength, and I'm also going to show you some exercises which will help you increase the dexterity in your hands. Is there anything in particular that's causing you concern or discomfort?
Well, my left hand is the main problem. I feel like I can't rely on it. It's all weak and wobbly, and sometimes it suddenly goes floppy, or the muscles will go tight and start twitching and shaking about all on their own. There's nothing I can do about it. Can't grip things properly either, and of course I need the other hand for my walking stick. I really don't want to end up having an accident because I've not been able to pick up a cup of tea or hold on properly to a stair rail or something like that.
Question 29. You hear a GP talking to a patient at a community practice. Now read the question.
So I understand that my 15-year-old daughter came to see you a few days ago. I don't want to snoop or betray her trust, but I would like to know what the rules or laws in England are regarding confidentiality. I mean, surely as her parent, I'm allowed to know what's going on.
Well, under 16s are entitled to come and see us in confidence if they're believed to be competent enough to fully understand the situation. We don't disclose information, even if it's extremely sensitive, unless there's a grave risk of serious harm.
But how am I supposed to look after her properly if she's really sick and hiding it from me for some reason? I'm not happy about this at all. I wonder why she's not telling me.
We would always encourage a young adult to discuss issues with their parents, but in extreme cases, yes, the law does require us to report information in order to protect the patient.
Question 30. You hear a senior nurse talking to the staff at a care home about the use of hoists. Now read the question.
As you can see, we have hoists in all the bathrooms. They are complicated to use and potentially dangerous, so in order to avoid injuries, falls or any distress to patients, the correct protocol must be followed at all times when using this equipment. It's absolutely vital that a handling plan is completed for all patients who need to be moved using this type of equipment. It should detail all of the specific requirements, and by that I mean type of hoist, technique, number of trained handlers required, sling attachment, loops to be used, and, where applicable, leg configurations. Everybody should go through this checklist with another member of staff every single time before using one, and nobody is to use one if they haven't attended the relevant course.
This is the end of Part B. Now, look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer, A, B, or C, which best fits according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1 for questions 31 to 36. You hear the lecture given by a physician on the standard method of diagnosing attention deficit hyperactivity disorder. You have 90 seconds to read questions 31 to 36. The standard methods of diagnosing and assessing attention deficit hyperactivity disorder used by mental health professionals is application of the criteria established in the Diagnostic and Statistical Manual for Mental Disorders that identifies 3 presentations of attention deficit hyperactivity disorder: combined presentation, predominantly inattentive presentation, predominantly hyperactive impulsive presentation. Functional neuroimaging, such as SPECT scanning, is considered an effective tool for researchers. Type 1. Classic attention deficit disorder. People with classic attention deficit disorder have reduced blood flow in their brain area of the prefrontal cortex, cerebellum, and basal ganglia. The basal ganglia produces dopamine. Type 2. Inattentive attention deficit disorder. People with inattentive attention deficit disorder are often described as daydreamers, space cadets, and couch potatoes. This type is more common in girls than boys and is often diagnosed later in life because people with type 2 inattentive attention disorder don't have behavioral problems. People with this disorder have reduced activity in the prefrontal cortex as well as low levels of dopamine. Type 3. Over-focused attention deficit disorder. People with over-focused attention deficit disorder have a deficiency of dopamine and serotonin. The aim of treatment is to increase both these neurotransmitters, the nervous system's chemical messengers. Type 4. Temporal lobe attention deficit disorder. People with this type might see or hear things that are not there, and learning and memory problems may be present. The patients will have irregularities in their temporal lobes and less activity in the prefrontal cortex part of the brain. The aim of treatment is to soothe neuronal activity and stop nerve cells from overfiring or firing unpredictably. Type 5. Limbic attention deficit disorder. People with limbic attention deficit disorder have excessive activity in the limbic section of the brain, which is where moods are controlled. They have reduced activity in the prefrontal cortex, both when relaxing or focusing on a task. Type 6. Ring of fire attention deficit disorder. People with ring of fire attention deficit disorder have an overactive brain. There are excessive amounts of activity in the central cortex and other areas of the brain. Type 7. Anxious attention deficit disorder. People with anxious attention deficit disorder have high levels of activity in the basal ganglia that aid in making dopamine. This differs from the majority of the other attention deficit disorder types, which have low activity in this part of the brain. It is possible to have more than one of these types of attention deficit disorder. For example, a common combination is overfocused, limbic, and anxious types.
Extract 2, questions 37 to 42. You hear an interview with Dr. Bruce Arnott discussing his work on aspergillosis. Now read the question. You now have 90 seconds.
Welcome to the Health Matters podcast. Joining me today is Dr. Bruce Arnott, joining us all the way from San Francisco. Welcome to London, Dr. Arnott. It's a pleasure to have you on today's podcast.
Thank you. It's great to be over on this side of the pond for a change.
So, one of your specialties is infections, particularly ones caused by various fungi.
Right. Today I'll be talking about aspergillosis, which is an infection caused by a type of mold. The illnesses resulting from aspergillosis usually affects the respiratory system, but their signs and severity vary greatly.
What causes it, and how can someone know that they've got it?
The mold that triggers the illnesses, Aspergillus, is everywhere, indoors and outdoors. Most strains of this mold are harmless, but a few can cause serious illnesses when people with weakened immune systems, underlying lung disease, or asthma inhale their spores. In some people, the spores trigger an allergic reaction. Other people develop mild to serious lung infections. The most serious form of aspergillosis, invasive aspergillosis, occurs when the infection spreads to blood vessels and beyond. To answer your second question, the signs and symptoms of aspergillosis vary with the type of illness you develop. Symptoms include an allergic reaction. So some people with asthma or cystic fibrosis have an allergic reaction to aspergillus. Signs and symptoms of this condition, known as allergic bronchopulmonary aspergillosis, include fever, a cough that may bring up blood or plugs of mucus, worsening asthma. I should point out, though, that aspergillosis is not contagious from person to person.
Are some people more at risk of getting it than others?
That's a good question, and the short answer is yes. Your risk of developing aspergillosis depends on your overall health and the extent of your exposure to mold. In general, these factors make you more vulnerable to aspergillosis. Weakened immune system. People taking immune-suppressing drugs after undergoing transplant surgery, especially bone marrow or stem cell transplants, or people who have certain cancers of the blood, are at highest risk of invasive aspergillosis. People in the later stages of AIDS also may be at increased risk. Low white blood cell level. People who have had chemotherapy, an organ transplant, or leukemia have lower white cell levels, making them more susceptible to invasive aspergillosis. So does having chronic granulomatosis disease, an inherited disorder that affects immune system cells. Lung cavities. People who have air spaces or cavities in their lungs are at a higher risk of developing aspergillomas. Asthma or cystic fibrosis. People with asthma or cystic fibrosis, especially those whose lung problems are long-standing or hard to control, are more likely to have an allergic response to Aspergillus mold. Long-term corticosteroid therapy. Long-term use of corticosteroids may increase the risk of aspergillosis and similar infections, depending on the underlying disease being treated and what other drugs are being used.
I think it's a lot more serious than I first thought when I heard of the condition.
That's true. Depending on the type of infection, aspergillosis can cause a variety of serious complications, for example, bleeding. Both aspergillomas and invasive aspergillosis can cause severe bleeding in your lungs. Systemic infection is another. The most serious complication of invasive aspergillosis is the spread of the infection to other parts of your body, especially your brain, heart, and kidneys. Invasive aspergillosis spreads rapidly and may be fatal.
Is there a cure?
Like with anything, prevention is better than cure. In fact, it's nearly impossible to avoid exposure to aspergillus, but if you have had a transplant or are undergoing chemotherapy, try to stay away from places where you're likely to encounter mold, such as construction sites, compost piles, and buildings that store grain. If you have a weakened immune system, your doctor may advise you to wear a face mask to avoid being exposed to aspergillus and other airborne infectious agents. Aspergilloma requires surgery, and invasive pulmonary aspergillus would need an antifungal medicine directly into a vein.
That is the end of Part C. You now have 2 minutes to check your work.